It's a pleasure to let that go past. Yeah, it's a pleasure to have been asked to speak to you all tonight. And I recognise one or two familiar faces and names as well from those who are here as well. So nice to see some of you again. For those of you who have not met, my name's Oliver Welsby. I'm the lead consultant at Brightcore Consultancy, as you can probably tell from the banners behind me, to be honest. We're a specialist organisation that works with schools and colleges nationally to support both safeguarding and mental health in education. We work with just over 900 schools and colleges and a few different trusts and school groups, and also quite a few local authorities have now sort of commissioned us to improve their safeguarding and mental health provision as well. So that's me and what we do. I know we've worked with some of you before, but tonight I'm going to speak to you about an update really around mental health in education and how things are changing, and really the kind of the need for an effective whole school and college approach to be put in place. So I'm going to share the slides. So let me just load up the first slide that hopefully you'll all be able to see. There we go. What I want to talk about is quite a lot of different things actually all connected to this idea of a whole school approach. The first thing just to think about is when we're in the business of education, when we reflect on what our kind of core purpose is, and whether we're talking about a curriculum or the core purpose of schools in general, if we think about what we're in the business of doing, what we're trying to produce at the end of the day, well, we could debate this and talk about it for a long time, but generally we all end up in a certain place. We all generally say we're trying to prepare and equip young people for life as independent adults. We're trying to produce happy, successful young adults at the end of this process. And I don't mean happy as in jazz hands wandering around smiling all the time, but I mean happy as in positive in outlook, resilient, able to deal with adversity. And then ultimately we're trying to create positive contributors to society. So when we think about a curriculum and our kind of core purpose as education settings like that, we almost need to work backwards from that point and say, right, how do we want our young people to leave our schools? How do we want them to walk out the door on the last day that we are responsible for their educational provision? And it doesn't really matter whether they leave us at age 8, 11, 14, 16, 18, 21, 25 in some cases. How do we want them to walk out the door on that last day? And then crucially, how do we get them there is the key question. So when we think about producing successful young adults, a focus on mental health and well-being is actually nothing new and shouldn't be a surprise to many of us, really. It was the Gutman and Vorhaus report that the DfE commissioned back in 2012, so we're talking 12 years ago, that conclusively showed that emotional well-being is a better predictor of success than anything else in life. Demographics, how much your family earns, the grades you get, and so on. So actually, if we are focusing on producing positive contributors to society, then actually we should really be focusing on emotional well-being at the core of what we do. And yet we seem to have a bit of a problem in this area. So what I want to do is just update you on some of the statistics, some of the research, some of the changes over the last few years and also the last few decades as well, really. And one of the key questions we often talk about with the delegates on our training courses, and we train lots of senior mental health leads nationally and have done for many years. One of the key questions we often debate is this one, are mental health problems really on the rise for children and young people? And often the immediate answer is yes, because, well, let's look at what we're dealing with, the amount of concerns that we're seeing, CAMHS are swamped and so on and so forth. But there's also validity in the no arguments. And the no arguments often revolve around the fact that we are talking about things and dealing with things that 20, 30 years ago nobody talked about. So perhaps we are responding to things that have always been there. We've also got what's known as the prevalence inflation hypothesis. And that is the more we focus on something and draw attention to it, the more we are likely to spot it and see it. So it could be we're focusing on this and therefore we see it. And it's really difficult to answer the question without looking at some key data. Because, for example, if we compare mental illness over the last 40, 50 years with physical illness, we can't just look at the raw numbers. So with most forms of physical illness, we can look at the rates of diagnoses over the last 40, 50 years. But with mental illness, we can't really do that because we've got such a degree of cultural change and clinical understanding and so on. I'll give you a figure to illustrate that. If you look at rates of mental illness in adults in the 1970s, at 1975, it was 1 in 100 adults experienced mental illness. Last year, it was 1 in 4. Things got 25 times worse since 1970. I'm sure we don't know, but I don't think they have. So if we're going to answer this question, we really need to look at current data to try and eliminate those kind of longitudinal trends, as it were. So if we just look at current data, if we look at some of the NHS data, what we can see when we're looking at children and young people, if we look at the NHS digital study from November 2018, it was actually looking at the calendar year 2017. But what we saw there when they published their updates was that 1 in 8 young people had or met the criteria for a diagnosis of a mental disorder in that calendar year 2017. If you just look at school-age children from 5 to 16, it was 1 in 9. But if you include sixth form age, slightly higher rates, it was 1 in 8 overall. And 1 in 20 young people met the criteria for 2 or more diagnoses. Now, this was an increase because the previous NHS study, which by their own admission was a bit too long ago, was the 2004-05 academic year. And in that year, the data showed that 1 in 10 young people had a mental health concern. So what we got, and the reason I'm showing you this data now, is we'd gotten over a 20% increase pre-COVID. And it's easy to blame things on COVID. And of course, COVID has caused a lot of problems from a mental health and wellbeing point of view, it seems. But we were already seeing an increase in concerns pre-COVID. So we can't just attribute the concerns and the numbers now to COVID. And yet we absolutely need to look at COVID. So what we saw in early 2020, anecdotally, was lots of people saying we're seeing an increase in mental health concerns. And so the NHS repeated the study, what they called the Wave 1 follow-up, in the summer of 2020. And what that data showed, you can see the sort of red bar being added there. You can see it didn't really matter whether we were looking at boys or girls, primary or secondary age. We'd seen an increase in concerns. And that increase in concerns had gone from 1 in 9 young people to 1 in 6 young people had got a mental health concern. So it'd gone up by a third again, just in a couple of years or 3 years, really, in terms of the data within it. But then people sort of said, well, actually, that's the end of lockdown 1. There's lots of reasons why we might have seen an increase in mental health concerns then. So the NHS repeated the study, the Wave 2 follow-up, as it was known, in September 21. And in September 21, you can see the sort of grey column being added in there. And it didn't really matter whether you looked at boys or girls. We saw a slight increase in school-age boys, a slight decrease in sixth form age girls. But overall, the data had stayed at 1 in 6 young people. But then you could say, well, okay, September 21, that's not too far after lockdown 3, and that was pretty horrendous. So what about after that? And then the NHS repeated the study in November 22, the Wave 3 follow-up. And that data showed that actually it had stayed at 1 in 6 young people of school age. But actually, when we look at sixth form age, you can see right down at the bottom of the screen there, it had now increased to 1 in 4 young people, actually over that 25.7%. So things have got worse again by the end of November 22. And then if we look at the most recent update, the Wave 4 update, that was conducted and published in November 23, so about 6 months ago. And now what we can see is rates of mental illness in children have gone from 1 in 6 to 1 in 5. And the sixth form rate has just dropped slightly, but it's just under 1 in 4. So whichever way you look at it, even if we just look at recent NHS data, since 2017, the likelihood of a young person having a mental health problem has gone up by 60%. And, 6-7 years is a short enough time frame to kind of eliminate a lot of those variables that we talked about before. And eating disorders, we've seen a significant increase. So they've gone up 84% in 5 years as well. We don't just need to look at the NHS data. You can look at studies like the Good Childhood Report, for example, that the Children's Society publish every September. And they measure lots of different things in their Good Childhood Index. It's a really rigorous study, actually. And their data is collated and analysed. It's got a kind of 2-year lag in it. So the 23 report, the data within it goes up to the end of 21 and so on. And amongst lots of other things, they look at happiness in children. And you can see there from the data, we've got in terms of that graph there, a continual decline pretty much from 2009-10 in children's happiness in the UK. And I think that's quite interesting, because happiness is quite subjective, isn't it? It's how you feel about how you are. People can't tell you you're happy. Well, they can, but they can't make you happy. And what's really, so something's going on. We've got this change over sort of 15 years or so here. And actually, when we look at other measures and you look at trends over time going back to the 1990s, in quite a number of studies, children's happiness increased every single year from 1990 onwards. And then round about that 2007-9 figure, the date, sorry, we started to see a decline. So something's going on. Now, what that is the subject of considerable debate. And not that we're going to be able to answer in full tonight, but I'll point you at a few of the things that are going on as we go through. It's not all necessarily negative, though. Yes, mental health concerns, we seem to see a significant increase in concerns. But if you look at other data and other studies, well, this is the percentage of pupils who've ever tried cannabis. And you can see they're generally a significant decline since the late 1980s, the early 1990s, when perhaps many of the teachers' generation were at school. So, yeah, a significant decline in that area. If you look at the percentage of pupils who never smoked anything at all, sadly, this doesn't include vapes, which is the bane of every school's life at the moment, I know, but you can see generally a significant increase over time. And if you look at the percentage of pupils who drank alcohol in the last week, again, significant decline from the 1980s down to the 2020s. So it's not all negative news from a health perspective, but it does appear to be from a mental health point of view. It's almost as if young people are swapping vices for stressors. Now, it's really interesting when you look at all of these vices, these are generally things that people don't do on their own. You don't generally smoke, try cannabis or drink alcohol on your own. And so what we're actually seeing is also a link with a reduction in social connection. And we'll come back to that point in a few minutes. If you look at some other data, if we look at change over this time period as well from the 1990s onwards, if you look at the data around antidepressant prescriptions, you can see we've had a significant increase in the number of scripts written over this time frame, from 9 million in 1991 up to 86 million in 2023. That's now 8.5 million adults and 192,000 secondary and sixth form age young people. And when we look at the profile in terms of the peak age of onset, again, if you just look at for depression, if you just look at the graphs there, you can see from the mid-1990s, a 20-year period up to 2016. And even in the mid-1990s, the highest age of onset for women was 75 and men was 50. And yet, by the time we get to 2016, in both males and females, it's the late teens that is the peak age of onset. And when we talk about things like the burden of disease, the long-term impact of having an illness, we're talking significant numbers of years now that are affecting not only people from a health point of view, but also their age of peak productivity, generating income for the state. So there's a financial reason why states need to be addressing this more. If we look at other changes, because it's worth just looking at changes over the last 30 years, because there's so many elements that are playing into this. If we look at education settings, for example, if you look at the last 30 years, well, or 35 years, 34 years, whatever it is now, 33, that's the number. Tell I wasn't a maths teacher. In theory, the education system is as it was, isn't it? Michael Gove got his way with those reforms, what was it, 8-9 years ago now? And we went back to linear 2-year GCSEs and linear 2-year A-levels from those modular systems that were in place. So in theory, the academic system is as was. And yet you look within it, it is a different world. So in education, back in 1991, there was very little testing. SATs were fully introduced in 1992. Ofsted were invented, or whatever you want to call it, in 92, ISI in 99. There was less pressure for students and staff on results and free access to university at the end of the process. Just to illustrate, less pressure for staff. The school where I started teaching in 1991, I wasn't there, I hasten to add at that point, but in 1991, I know that the staff room had a full-size snooker table in it. I don't know about you, but it takes me an hour to play a frame of snooker. Imagine having an hour in the middle of your day to go and have a frame of snooker now in an education setting. But there we go. I don't think it lasted much longer than that. Oh, someone just needs to pop themselves on mute if that's okay. Just get a little bit of background noise there. If we look at where we are 2024? Well, without a shadow of a doubt, better quality teaching. Absolutely. And yet we've got Ofsted, we've got ISI, we've got pressure on results, we've got constant testing. You can argue really key stage 1 onwards, but definitely key stage 2 onwards. And then we've got this data target driven system where everyone is aware of the target, from the inspectors right down to the child ultimately. And then at the end of the process, we've got a £60,000 bill. I keep having to put this figure up on the research, but now currently a 3-year degree, if you include tuition fees and maintenance loans, that's £60,000. So hugely pressurized system that's very different. And break times, interestingly as well, have reduced quite significantly. So looking at the research, break times seem to have reduced by about 45 minutes a week in primary schools and 65 minutes a week in secondary schools, without any reduction in the average length of the school day. It's almost as if we kind of created a culture where we see relaxation as a bit of a luxury. Now, often it's generally the removal of kind of key stage 2 playtime in the afternoon at primaries and the shortening of a lunch hour to remove those behavioural problems in secondaries. But what we're seeing ultimately is a reduction in downtime for adults as well as children. And that means less relaxation. And now relaxation isn't a luxury, it's a biological necessity. You know, if you don't relax properly, you don't stimulate the parasympathetic nervous system, you don't digest food properly, you don't regulate blood pressure, you don't sleep properly, your body doesn't recover clinically during sleep, all of those kind of things. The reason stress is called the silent killer. So yeah, huge change in the educational system. If you look outside the education system as well, and I'm not for a minute talking about the good old days here, I'm just trying to illustrate cultural change to you. Back in the 1990s, most young people spent their spare time playing outside when they could, reading books, playing sports, listening to music. There's very little media consumption in its format that we know today, and obviously no socializing online because that didn't exist the same way. So spare time, when permitted, was spent with friends. And then there was considerable access to part-time jobs. If you look at how that's changed, we've seen a seismic shift really in childhood, more than any other generation really over the last 30 years. What we've got now is very limited outdoor play. In fact, very limited time outdoors in general, along with a dramatic rise in obesity levels over the last decade plus. I think it was the National Trust did a survey back in 2018, which showed that UK children now spend less time outdoors each day than, on average, including holidays, than grade A maximum security prisoners. So grade A maximum security prisoners have to have an hour a day in the yard, or whatever you call it. And UK children were averaging 36 minutes in that study. So it's really interesting. You know, we all saw it in lockdown 1, didn't we, when we couldn't go outdoors, the impact that had on our well-being. And yet we're not doing it to the same degree. And equally, we've got a culture of surveillance now. Most young people, according to Ofcom, take part in 1 or less activities outside the home each week now. So almost all socializing is at home online. And therefore, there's a degree of surveillance as well, and helicopter parenting and things like that that are having an impact. You think about your childhood. I think about this all the time. You think back to your childhood as adults, most of us, our happiest memories didn't have our parents standing over us. How do we learn to manage risk? How do we learn to explore and develop as we do as adolescents? Well, generally, if we're at home online, we're going to do that online. And no surprise, we're seeing an increase in online risk concerns, as it were. We've got a decline in reading books. 30% of UK children own no books now. Now, a lot of that has moved online. But when you look at research from people like Anne Mangan at Stavanger University in Norway, there's an impact around how we read text, whether it's from a screen or a printed page. There's still sport playing. It's a bit more organised now, generally a bit of a disgruntled parents ferrying to and fro and standing looking a bit irritated on the sidelines. But of course, there's still sport playing. They're still listening to music, but it's mainly watching music now, TikTok and YouTube, which neurologically is quite a different thing, actually. There's high and increasing media consumption. Most socializing, as I said before, is now online. We've got the impact of social media, which gets, in some ways, a fair bit of bad press, in others a bit unfairly. But we know there's this persuasive design. There's people whose job it is to get you to spend longer on devices. We've got constant exposure to advertising, constant social comparison. And we know a lot of the studies have shown that has an impact on self-esteem with excessive usage. So we know that's a factor as well. We've also got the attention economy out there, constant notifications, so we're getting distracted, but also people are competing to get us to spend longer and longer on platforms and devices. Worth looking up people like Tristan Harris and Asa Raskin, who've set up the Centre for Humane Technology. They're some senior executives from Silicon Valley who basically left saying, we've got to change how we do things here. Let's make technology work for us. Really interesting resources, I think, as well, for checking out for education settings. And then at the end of it, we've got quite limited access to part-time jobs. One of the previous schools I was in, when we were writing UCAS references, of all the sixth formers in the last year I was there, only one had a part-time job. That was it. You think back, going back a few decades, everybody had a part-time job. So yeah, real cultural change, real difference. If you look at how much media we're consuming as well, that has been the biggest area of cultural change, that we are constantly consuming media now. We're watching what we want, where we want, when we want it. Very much on demand. We're consuming news constantly. Again, if you look at Ofcom's data, in the summer of 2020, we consumed news about COVID alone 28 times a day on average. Now, I know it's scary, and that was, at the end of lockdown 1, but still, constant news. And news is generally quite negative, isn't it? The positive news stories don't get the clicks, they don't get the views, they don't rise up the ranking, as it were, in terms of the news feed. So if we're doing that separately, which most of us are, using a handheld device, whether it's a phone, a tablet, or a laptop, then not only are we being exposed to it as children as well, but we're also not having the opportunity to talk it through. We've seen a reduction in social connection, which we know is a big protective factor for mental health. So we've seen a kind of knock-on effect of constant tech usage, of a decline in delayed gratification, social connection, a bit of self-regulation as well. By delayed gratification, I mean, if, for example, and I'm not talking about the good old days, again, I'm just giving you a point, illustrating the point, but if 30 years ago you wanted to watch a TV program next Wednesday at 5 o'clock, you had to set your own body clock to watch it. Then you set the video recorders, if you remember those. Then it was the DVD recorder, then it was the Sky Planner, and now you don't need to do anything. In fact, now you actually have to press a button to not watch the next episode, otherwise it loads it up before you've got out of the seat. So yeah, great for boredom, awful for delayed gratification. Real decline in kind of social connection. We'll talk more about that later. And self-regulation. That's one thing we're not doing, is teaching self-regulation with tech. Now, if you look at research from organizations like Foundations, they show quite clearly that self-regulation is a huge protective factor for mental, but also physical health in adulthood. If we can teach children to self-regulate, it's going to be absolutely in everybody's interest, including the state, in terms of income generation. And yet what we're not doing with tech is teaching self-regulation at all. We all just pick it up whenever we get a notification and all that kind of thing. And as a result, we're getting an entitlement culture a little bit as well. We see it with adults, don't we? We talk about it in schools as the wine o'clock email. 9 o'clock at night, parents have had a glass of wine, email you will fix this for my child tomorrow. And statistically, you've linked your emails to your phone. So you've probably looked at it before you've gone to bed, and there's your night's sleep gone, because you've got an angry parent to deal with tomorrow, and all of those kind of things. So yeah, there's a knock-on effect of all of this, but it's just huge cultural change, isn't it? If you look at how much media we're consuming per person, and this is outside of work, just look at the increase in figures there. We've gone from sort of 20 minutes a day to, by 2019, 3 hours and 3 minutes a day. If you look at where we are now, we're at 5 hours and 3 minutes a day. So just in the last 4 years, it's gone up by 2 hours. Now that's outside of work. I don't know about you, I don't have 5 hours, 3 minutes a day outside of work. If you take out eating, sleeping, and commuting, there's not a right lot left for everybody else. So that means, some people are just constantly doing this. And if we are sitting next to each other, staring at screens, generally we're doing it in isolation, and we're not socially connecting if we're all consuming separate media. Interestingly, if you throw work into it, we've overtaken sleep a long time ago now, a couple of years ago. We now use communications devices for 10 hours, 23 minutes a day, which is more than sleep, 8 hours, 21 minutes a day on average. As I always say, I'm not sure who's getting all that sleep to make that the average. It's not me. But anyway, so yeah, really interesting, isn't it, that we are using technology for the majority of our waking day that 30 years ago, no one had imagined would have existed. And then also, in terms of cultural change, we're all working full time now, or a lot more of us are. So if you look at the percentage of young people who have both parents working full time, not necessarily living together, but just both working full time, the earliest data I could find was 1996 was 62%, and that's gone up to 78%. So lots of cultural change. There's so many variables. We can't just blame mental health concerns on tech, because there's some amazing ways to use tech. Although, we do get some media stories covering it that way. There's a lot of variables to do with, lots of the things I've just mentioned already this evening. So how do we respond? What do we do as education providers and in education settings? Well, the first thing is, if we're going to focus on mental health and well-being, we need to make sure that everybody knows what to do and how to respond. And this comes into the safeguarding requirements, actually. So I'm going to talk about keeping children safe for a minute or two. If you look at keeping children safe in education, part one, the bit that all staff in education settings should have read, you've probably got them to sign something to say they've understood it as well. It's got those 3 paragraphs in it. Paragraph 45, all staff should be aware that mental health problems can, in some cases, be an indicator of abuse, neglect, or exploitation. So we've got to be clear, when we look at the data, roughly 1 in 3 cases of mental illness in children is directly linked to a safeguarding concern that we may or may not know about. So all staff need to know about that link, because 1/3 is quite a high correlation. So we need to know that if we're spotting a mental health concern in a child, we need to bear in mind there might be a safeguarding concern going on that we don't know about yet. But equally, the reverse we need to think about as well. So if we've got children with safeguarding concerns going on, statistically, they're at higher risk when it comes to mental health concerns. So that's the first thing to bear in mind, the safeguarding link. And then secondly, paragraph 46, only appropriately trained professionals should attempt to make a diagnosis. I think we'd all agree with that one. But it's that next sentence that's the most important one. Education staff, however, are well placed to observe children day to day and to identify those whose behaviour suggests they may be experiencing a mental health problem or be at risk of one. And that's the training requirement, isn't it? Are your colleagues confident around what to spot and how to report it using whatever system you've got? Because that's something we need to be clear on. If we're going to be able to intervene early, we need to be able to spot things and report things and pick things up. Equally, the early help paragraph, which is paragraph 20, you can see there, which is a little bit earlier in the document. All school and college staff should be particularly alert to the potential need for early help for a child who's got a mental health need. So again, how can you be alert to an early help need unless you know what it is you're supposed to spot and how you're supposed to report it? So one recommendation I would make to all of you is just make sure you've got some mental health awareness training in place for all staff. And that covers things like signs and symptoms, behaviours, links with safeguarding, the impact of adverse childhood experiences and trauma, and so on. And you can do it as inset yourselves. You can get companies like us to do it. There's loads of ways of doing it, but really we want to make sure that, first of all, everybody's on the same page. The second thing we want to do is put an effective whole school approach in place. And this is an area, as some of you know, because we've worked with quite a few of you, this is an area we work in extensively, both from a safeguarding and a mental health point of view. If we just stay with keeping children safe in education, this phrase, a whole school approach, is mentioned over 20 times in the current document. We need a whole school approach to safeguarding. We need one to mental health and well-being. We need one for online safety, and we need one for preventing child and child abuse. So what are we actually talking about here, and what does that mean in terms of the inspectorates and so on? And it doesn't really matter whether you're under Ofsted or ISI, both of them talk about whole school approaches from a safeguarding and a well-being point of view. So what does it mean? Well, as I said, this is an area we're working extensively, and training senior mental health leads and safeguarding leads to have a key focus on what an effective whole school approach is crucial. And a whole school approach has got all of these aspects in it. So leadership, have you got someone who is operationally leading the provision, who is trained, who knows what they're doing and feels confident that they can deploy resources to improve the situation? Oversight, have you got governors who are trained, aware, understand, and are able to scrutinise and support? Policy, have you got a document that kind of sets out what you do? Procedures, do you actually do what it says you're going to do in your policy, including interventions and so on? Culture, that includes staff knowledge, training, confidence, the environment. Is everybody on the same page? Is everybody working to improve things in this field? Curriculum, of course, what do we educate young people about and how do we know that's any good? And then pupil voice and student voice, how do they have an input? How are they heard and how do they have ownership of what we've got in place? And then finally, parental engagement. How do we engage parents to at least buy into what we're doing and at best support that and replicate that at home? Now, full days, we do a lot of senior mental health lead training, and actually it's a 3-day program to go through all of that kind of stuff. But actually, when we think about this particular area, a whole school approach, the key question for any of us really in any education setting is it effective? How do we know what we're doing is effective? And that's where, from a mental health point of view, which is what we're talking about tonight, the DfE encourage everybody to engage and appoint a senior mental health lead in each education setting. And they do a lot of training and would like senior mental health leads to be trained using the 8 principles to promoting a whole school or college approach. And they come from this document, as you can see there on the right-hand side. As I said, this is an area we work in extensively. We wrote the pilot version of the course back when the green paper came out back in 2017, and we've trained over 1,200 senior mental health leads now. If you're interested, bit of shameless promotion here, if you are interested in senior mental health lead training, we know there's a real range of providers out there, ranging in quality, sadly. But ours is now, of all of the DfE approved senior mental health lead training programs nationally, ours is actually the highest rated of all of them. So we scored a perfect 5 out of 5 in all of the quality assurance standards, and we've got an average rating of 4.97 out of 5 for overall quality from over 1,200 delegates, with 100% of them recommending it. So if you are interested in looking at that side of things through us, you can find more information on our website. You can read hundreds of testimonials from previous delegates. Some of you are actually in the room, I noticed from the names list as well. So yeah, by all means, go and have a look at what we do if that's an area that you think actually we could enhance our training and provision. So coming back to, how do we evidence and evaluate the whole school approach? How do we know it's effective? How do we know it's good? Do we review it? Is one of the key questions. Do we look at it internally? Do we look at it externally? Now, what I mean by external review is quite interesting. If we look at the inspection handbooks, and it doesn't really matter whether you're under Ofsted or ISI, Ofsted it's paragraph 109, ISI it's paragraph 80. Both of them have got that same sentence in there that I've highlighted. Things that they'd like you to provide during the inspection, either at the start or during it. Any reports from any external evaluations you've had done of the school. And this is an area that we work extensively with the many schools that we work with, providing those external evaluations, that kind of friendly pair of eyes. How do you know what you don't know? It's always the worry as a DSL or as a mental health lead, isn't it? What am I missing here? Because we know it's one of the first things that gets looked at. So always worth thinking. Absolutely, we review things internally, we peer review, we do them within trusts and foundations, but do we get an external pair of eyes to look at this? And what's the benefits to us as an organisation of doing that? You can tell it's come from the DfE because both the inspectorates put it in at the same time. Now, if we are going to focus on improving well-being, then what we're really talking about in education settings is prevention. And there's a quote there from the often quoted Frederick Douglass: "It's easier to build strong children than to repair broken adults." It's actually a misquote, that it's an adapted quote. The original quote was, "It's easier to build strong boys than to repair broken men," because apparently women didn't exist in the 19th century. But I like the adapted quote better. I think it's more valid today, written like that, of course. So really what we're talking about is trying to prevent illness. And if we look at the current definition of safeguarding, the second bullet point there is preventing the impairment of children's mental and physical health or development. So it's a safeguarding responsibility to try and prevent illness. And we also know from a societal point of view, the benefit to society is prevention is better than a cure, isn't it? As the phrase goes. Now, we know, looking at the research, that most mental health problems are preventable. But not only that, there is also considerable scope for increasing interventions that reduce the rates of mental health problems developing or the severity and so on. Equally, when you look at the statistics on the right-hand side, we know that if we are going to prevent, we have to do it in the school age years, because currently 1 in 5 children have a diagnosable mental illness. Half of all mental health problems that adults experience are already established by the age of 14. And according to MHF England, 3/4 of all mental health problems that adults experience are established by the age of 18. So it feels like this is something else coming into schools and colleges. I know, as I said, we work with hundreds of them, but if we are going to prevent, then we need to do it in the school age years. And equally, when we look at prevention, a lot of that is about education, understanding how the mind works, seeking support, training, interventions, identifying concerns early, all of which are more our remit in education settings than clinical practitioners, who very much have a kind of treatment therapeutic input. So prevention is our core business. And when we look at prevention, we talk about it, you see the Guardian article there is the holy grail, really. And this is what we structure the senior mental health lead training around. What does this actually look like? How do we make it effective? And when we look at prevention, really, we've got three strands to it. We've got primary, secondary, and tertiary. So primary prevention is where we educate the whole population, adults as well as children, of course, because most of us as adults didn't have much training around looking after our own mental health. Come to that in a minute. So that includes the curriculum. It includes understanding how the mind works, seeking support, and so on. Everybody should be getting that every year. Then we've got secondary prevention, and secondary prevention is where we target the at-risk groups. So we know, looking at the research, that certain groups of young people are statistically at far higher risk of developing mental illness than others. So if we know that is the case, what are we doing to try and prevent that from happening, rather than just waiting for symptoms to present and then treating them? So that secondary prevention is a core area of work, and it's an area we work extensively in with a number of local authorities as well now, in terms of what this can look like, because that generally is the biggest area of need nationally. And then tertiary prevention. Tertiary prevention is where we've got young people who are ill and or have been ill, and then we put things in place to prevent it reoccurring. And that's where the Senko comes in, as well as any clinical professionals you've got on your site as well. Generally, I find from all the reviews we've done nationally, schools and colleges are all over tertiary prevention. We deploy every resource we've got. We'd like more, but we deploy as much as we can. Primary prevention is happening, but it's relatively new, and making that effective within the curriculum is a key responsibility of a whole school approach, key facet. But secondary prevention is the biggest area of need. What does that look like? That's the safeguarding responsibility, really. On top of trying to prevent illness, we know that promoting mental health and well-being is part of our core business. Not only the Gutman and Vorhaus report I mentioned earlier on, but we also know, and there's loads of studies out there now that show, that academic success is inextricably intertwined with both physical and mental well-being. If children are mentally well and physically well, they will perform better in examinations, according to the research. So even if we believe that education is just about academic results, well, even then, there's a reason we should be focusing on mental health more than we do. The need for a whole school approach. The other thing we've got to make sure we focus on is the adults in the organisation. There's a quote here from Ian Morris, who many of you may well know, used to be head of wellbeing at Wellington College. There's a quote from his book there, Learning to Ride Elephants, Teaching Happiness in Schools, from back in 2009. And back then, obviously, teaching happiness, sometimes a lot of schools thought, or people thought, oh, that's a bit woolly, isn't it? But this quote, I think, is as valid now as it was then. And as he said, if we are aspiring to use educational opportunities to inculcate the important skills of well-being in our students, we must model those skills ourselves. This means for a school to take the teaching of well-being seriously, it must make sure that its teachers are given the opportunity to learn the skills of well-being through CPD. There's little point in having happiness or well-being on the curriculum if it forms only a small slice of the experience students have at school. And I think it's so true. You know, we've got to get it right from a staff point of view, first and foremost. And again, it's a key part of what we talk about on the senior mental health lead training side of things. I did a well-being review with a school a few years ago now, might even be 4 years back. COVID clock in my head, I can't remember the years anymore. And I remember talking to a group of students about what they got taught about to do with mental health and well-being. And a couple of students, one of them said, oh, we get told how to deal with stress, and then sort of sniggered with one of his friends. And I said, oh, come on, why did you respond like that? And he said, well, our teachers are the most stressed group of people we've ever met, and they're telling us how to deal with stress. And you think, yeah, well, that's a fair point, isn't it? If we're not careful, this can be hypocritical. So any effective whole school approach has to have at its core a focus on staff well-being. If we don't get that bit right, this is a token gesture. And if we look at some data on that, if you look at data from the amazing National Charity Education Support, if you look at their Teacher Wellbeing Index, you can see the graph at the top right there, vacancies doubling in the past 2 years, but actually the gap between people leaving education and retiring and leaving to go to another profession, the blue column, as it were, is huge and growing every year. More and more people are leaving teaching, not because they're retiring, but because they don't want to do this anymore or can't do this anymore. And if you look at their data at the bottom, it's pretty sad data, really. 59% of staff considered leaving the sector in the past academic year because of pressures on their mental health. 55% have actively sought to change a job. 68% of staff cite volume of workload as the main reason for thinking about leaving their jobs. Just a few other statistics from it as well. 78% of staff describe themselves as stressed. Say 89% of senior leaders. 55% of staff consider their organization's culture is having a negative impact on their well-being. And 46% say they don't get their organizations don't support their employees well when there's mental health concerns. So we've got a way to go with this, and it's crucial that we focus on staff well-being at the core of this. And when I mean staff well-being, I mean all of the staff. I don't mean the senior team suddenly covering loads more lessons to give everybody some time off, because that's not helping the senior team. And any whole school approach absolutely has to start at the very top. If you look at the ASCL survey, when they surveyed senior leaders in education, you can see from that survey that they did, 40% of assistant heads, deputy heads and heads plan to not be in the profession 5 years from now. Now, if you take out the 6.8% who were going to retire normally in the next 5 years, that only leaves 53% of senior leaders in education in the next 5 years. Now, we've got to do something about this because, as you all know, no one goes into education to be rich and powerful and rule the world, do they? They go into education to help young people. And it has to be a core thing that we focus on is keeping the amazing professionals in this job, because that's going to benefit the children just as much as everybody else. So we have to focus on staff well-being, but we have to focus on the senior team as well. If you look at the NAHT survey from a few months ago, we can see discontent among senior leaders is rising. 57% of senior leaders wouldn't recommend it as a career choice. 61% said their work satisfaction has declined over the last 12 months. 61% of assistant and deputy heads now don't want to be heads. That's a 53% increase in the last 8 years. And 49% of school leaders have needed some sort of mental health or wellbeing support in the last 12 months, and nearly 40%, 38% have accessed professional support. So we really, really need to get to grips with any whole school approach, incorporating the senior team and incorporating the whole staff, really, just as much as focusing on the young people. And we look at strategies for doing that. Apologies, we're not going to have time to go through all those kind of things with you tonight. I could spend days talking about this topic, but it is an essential part of what we put in place to make a whole school approach effective and crucially sustainable, and making sure that we also have those kind of campfire moments, those moments of relaxation, that we make sure we build those into our day, not necessarily the school day, although we do need breaks within the school day, but making sure as professionals we understand the value of relaxation and don't just treat it as a luxury. In terms of supports, I'm pretty much near the end of what I'm going to talk to you about now, but in terms of support, if any of you want any more information about what we do, I'm just going to stop sharing this screen and very quickly just share our website and give you some information in terms of different things that you can find on there. Hopefully you can now all see the website there as well. It's just brightcoreconsultancy.com. If you're interested in anything in terms of any of the courses or the training that we do, you can find them on the courses tab. We do lots of kind of subsidised courses for schools and education settings. So mental health first aid training, for example, is subsidised by 50% for education settings. But you can find more information about the services that we offer on the services tab. And there's absolutely loads of different areas that we cover. And obviously mental health is what we're talking about today. So you can see all the different things that we do in terms of the reviews and so on. So if you are interested and you want to get in touch, please, by all means, have a look at the website. You can also see, I did mention the testimonials. You can see many of the hundreds of different testimonials that we've had from different organisations. Some of you even in the room tonight are on there as well. So thank you for those. And they're all named by people who've given them as well. So there we go. I hope that was of use. And I hope I've been able to signpost some interesting statistics and research. And I'm more than happy to kind of answer any questions or hand back to Alicia at this point and take her lead as to what's next.